Life is beginning to return to normal in Wuhan, China, with the end of the travel restrictions in the city where the coronavirus was first detected. Hello, I'm Arnold Naidu, and this is The Heat. Lots of developments in the past 24 hours. British Prime Minister Boris Johnson is in intensive care at a London hospital. He's not on a ventilator and in stable condition. In the United States, 731 people have died in New York State since Monday. That's the largest number of deaths in a single day since the crisis began. And a glimmer of hope from China. For the first time since January, the country recorded no deaths related to the outbreak. And after 10 weeks, the city of Wuhan, home to 11 million people, lifted its travel restrictions. George Eshin has this report from Wuhan.
After 76 days of lockdown, the once virus-hit city starts a new chapter. Starting Wednesday, Wuhan authorities have restored all outbound modes of transit. Many locals and stranded out-of-towners are now able to go back to their jobs or families.
I work in the city and didn't think of going back before the lockdown. But now, I feel so happy to go back. We've been waiting for this moment.
There's been distress among us for a long time. I believe everyone will feel pleasant now. We're very excited about it.
I want to thank all the efforts made by the people in Wuhan, especially those on the front lines. They made this achievement.
Some outbound travel was permitted, but only with specific permits and health checks, such as transportation of supplies and resumption of migrant work. But now, thick traffic is expected. Wuhan's traffic agency has removed 75 checkpoints on outbound highways so as to ensure smooth traffic as usual. But it says they do check vehicles that may affect the prevention and control of the epidemic and public security or traffic order.
On the same day, trains and flights bound to cities inside and outside Hubei province reopened as well. But some restrictions still remain. For instance, daily trains from Wuhan to cities like Beijing are not immediately available due to the local prevention plans.
Wuhan authorities say those flights and trains are reopening orderly while the resumption of all traffic is slowly but surely returning to normal. They warn that epidemic prevention is under a new test given the potential of reinfection and asymptomatic cases, and intercity travel, communities, and public places should maintain a new level of vigilance. Zhou Jiaxing, CGTN, Wuhan.
To talk about all of this, let's bring in our panel. Joining us via Skype from New York State, Brittany Kamush is a professor of public health at Syracuse University. Also via Skype, Peter Chen-Hung is a doctor treating COVID-19 patients in San Francisco. From London, we have CGTN correspondent Ollie Barrett, and Aina Tangen is a current affairs commentator joining us from Beijing. Welcome to all of you. Aina, let's start there in Beijing, and a major development in China, of course. No deaths reported, and the only infections coming into the country is coming from the outside, of course. What were the conditions that led to the reopening of Wuhan?
Well, it's all dictated by the data, Arlen. I mean, this is a situation where China is letting the science go first and being very cautious about what is going to be a difficult, but hopefully very short economic recovery.
So I know we heard our reporter tell us there that life is beginning to return to normal in Hubei province. That's where the city of Wuhan is. What does that mean, life beginning to return to normal? Have all restrictions now been lifted? Can people go about their business as they did before this virus broke out?
No, it's not quite that simple. There's a real concern about reinfection. When you go in and out of places, they take your temperature. There's still social distancing. People are still wearing their masks. People are very, very cautious here. There's no desire to flaunt what the government restrictions or anything like that. And people, they've just come through a 10-week ordeal. They understand that, things are still precarious. So they're going to go about it. But what it means internationally is that Wuhan is a center for the automotive industry, especially parts chemicals, a lot of the chemicals that are actually needed around the world, not only in industrial processes, but some in the medical field, will now be available as these companies restart.
That's right. The economic impact will also be very big, and I want to get to that a little bit later. But let me go to Peter right now in San Francisco. And Peter, looking at the Chinese experience, that must be some source of comfort for other communities and cities around the world. You know, you look at this; it's something that was so sudden, so big. It was an unknown thing that hit us. But we see one part of the world has overcome it. It's getting back to normal. That must be some comfort to people around the world.
It is a comfort, but then again, it gives us something to aspire to. I feel that in the United States, it's like 50 different countries rather than one. We don't have closed borders amongst the states. So if one state is doing something different from the other state, and we don't do intelligent disease screening at the borders, if one does shelter in place or social distancing and the other doesn't, we don't know how long we're going to keep that up for, because you can get reinfected from another state.
Peter, what's the situation like where you are in San Francisco? You know, we see these stories and we see pictures and we read reports coming out of other cities where doctors are really having a hard time. There's a shortage of equipment. They're really overwhelmed. Hospitals are overwhelmed as well.
I would say the situation changed, evolved between the last 3 weeks and now. I think even as short as a week or two ago, we were facing a low morale because we didn't have something as simple as a 10-cent mask. Enough of that because the pipeline had dried up from places like in China, who needed it for their own epidemic at the time. So I think we got community drives. We got donations from companies like Mark Benioff from Salesforce. And right now we feel okay with the acute need of having enough face masks. So we have universal masks on right now at the hospital. But again, we don't know how long we're going to be in this for, you know, this marathon. So I feel for the long term, we still have some shortages. We also have problems with having enough swabs, again, for doing the diagnostic testing. So, you know, even though we have the machines, we still have some supply issues.
All right, let's bring in Brittany from New York State. Brittany, China was able to flatten the curve. That's a new term we're hearing now. Flattening the curve and social distancing, all new terms. It was able to flatten the curve to the point where it is now reopening a major part of the country and a major city is being reopened as well. What are the lessons there for the rest of the world?
I think some of the lessons are how effective social distancing can be if it's followed effectively. As Peter was saying, in the United States, we have different policies by every state has a different policy. And so it's going to be hard to know how well the US and other places are doing because of all these different policies.
Ollie Barrett, the British Prime Minister, Boris Johnson, he is still in the hospital. He's still in the intensive care unit. What's the latest from there?
Yeah, second night in intensive care for Boris Johnson. Downing Street updating us that he remains in a stable condition, also telling us that he has not yet required the use of a ventilator nor any mechanical support with his breathing. He has at times been on an oxygen supply for support with his breathing, but as I say, no ventilator, and that is considered really quite good news for Boris Johnson. The statistics are pretty stark for people who enter ICU and require a ventilator pretty quickly. So that's considered to be grounds for optimism for Boris Johnson, but he remains in intensive care for that second night in what, as I say, Downing Street is describing as a stable condition.
Ollie, what should we read into the fact that he's not on a ventilator?
Well, as I say, the statistics show that if you are one of those people who enter intensive care with coronavirus COVID-19 and you require ventilation early, then the prognosis is much worse for you than for those people who don't immediately require that over the first 24-hour period. So certainly it is considered a good sign for Boris Johnson that he hasn't deteriorated in terms of his breathing to that effect. All of that said, there's still quite a lot about his condition we don't know. as I say, Downing Street only really telling us that that he's in a stable condition, receiving excellent care from some of the best doctors in the world at St Thomas's Hospital in central London. So a lot that is still unclear about his condition, but certainly Downing Street is repeatedly telling us that news about the fact that he hasn't yet required the use of a ventilator, partly because they know that it will reassure many people in terms of his prognosis.
Aina Tangan, you were telling us a moment ago about Wuhan being the a center of manufacturing in China for the auto industry. And are most factories and plants now reopened in Wuhan?
A large percentage of them, I think it's upward of 80%. But the real issue is workers coming in and out. Remember, when this quarantine was put on, there are workers from outside the city of Wuhan who could not get back in. Now they can come back. There are, unfortunately, a number of businesses that have shuttered, off almost 500,000. But there, and that was in the first quarter. But there were 3.2 million new businesses that were started up, surprisingly, during that same quarter, down 29%, but still a very hopeful sign. In terms of how Wuhan reintegrates, there's going to be, a press in terms of the logistics, getting the materials there, reestablishing the supply lines, making sure that the logistics are working once again. But once that comes in, I think there will be a tremendous amount of relief for the rest of the world, especially automobile companies, chemical companies, who need these vital pieces in the things that they do.
And how badly has the Chinese economy been hurt? I mean, what about growth rates? What kind of growth rate are they expecting this year?
Well, right now there's a debate on whether or not to establish a growth rate or not, and that decision will soon be made. I'm sure that the government will come out and make a determination within the next month or so. It's very, very difficult to say because China internally has a fairly strong demand. They have a tremendous, the largest consumer market in the world, and they also have the production. So internally they can readjust. They can make up for areas where they were importing things from outside. They can retask industries. But the big question mark is what happens internationally. Obviously, China is a big part of the global supply chain. With a lot of that going away and the uncertainty over how long this COVID-19 is going to continue based on, as my two colleagues have said, the kind of patchwork approach, not only in the United States, but think of it on a global basis. Until COVID-19 is under wraps, contained, it's going to be very hard to open up and reestablish the norm that was before.
Peter, looking at the situation here in the United States, and if we just look at New York, which is one of the hardest hit areas, more than 1,800 people have died in just one day. In fact, the figure I looked at just about half an hour ago was 1,845. We did get these warnings from the White House coronavirus group telling us that this week could be the hardest. In fact, it could be this week, next week, and the week after that as well. How big a challenge in these next 3 weeks is that going to be for the healthcare system?
I think it'll be a tremendous challenge. I mean, even in California, where we haven't seen as many cases as New York, we're already worried about not having enough ventilators. I've heard from one of my colleagues today in New York City that, her mom was being admitted for COVID-19, and she was worried that there wasn't going to be an ICU bed waiting for it at one of the hospitals. So I think, facing that critical shortage of just basic equipment is something that the United States wasn't prepared for. We had closed down our pandemic office, some time ago, and I think it's just a wake-up call. So I think in terms of whether or not this week is the worst or next week is the worst, or, I don't know when it will stop. It will be, we're in for a long time.
And Peter, looking a bit more broadly at the state of California, what's the situation been in the state? Have they managed to keep numbers down?
Yeah, so we started our shelter-in-place policy before many other places. We started it on March 17th. New York City didn't start it until about a week later. At the time when we started, we actually had around the same number of cases. Of course, New York is very different from San Francisco in terms of crowding, subways, etc. But I think shelter in place, we think here, did have an impact, at least on having the resources keep in step with the number of sick people coming in. Of course, we have sick people coming in, but right now we have enough ventilators for them in California. What we didn't want to have was a big surge of people where we couldn't keep up with that demand.
Brittany, you mentioned social distancing a moment ago, and I'm just wondering, what is it about the social distancing guidelines that a lot of people, including the president, and if we look today at people in Wisconsin, they don't get this. I mean, there's an election taking place today in Wisconsin. It's an in-person voting election. This is going to bring people in very close proximity to each other. What is it that they don't get?
I think it's just very hard for people in the United States and probably elsewhere to do things that they're, demanded to do. It's not, we like to think that we have free will and freedom, and then if somebody tells us we can't do something, we don't necessarily like it. And what we need to do is the social distancing to break those chains of transmission in order to keep the number of cases down.
Those chains of transmission that you're talking about and the effort to break them, have we seen that happen in the United States, in any one of these places?
I think there's some evidence in New York, for example, that the number of new cases seems to be leveling off from day to day. And so it's possible that we are lessening some of these chains of transmission, but I think the United States still has a long way to go.
And Brittany, how big an issue is it that the number of tests that are being carried out is still lagging? There's not the number of tests out there that people would like to see. And could this actually be hiding a bigger problem? Could the numbers actually, in reality, be much higher?
Yes. So the testing strategy at this point in the United States is to test kind of the sickest people, the people who have the most symptoms. And there's a lot of evidence that a lot of people who become infected only have mild symptoms. So we are likely missing a lot of cases.
Ollie Barrett, what is the coronavirus situation in the United Kingdom? Are people maintaining these social distancing guidelines and taking other precautions to protect themselves?
Certainly, we've been hearing from the government scientists in the daily coronavirus press briefings here in London that the data shows that the vast majority of British people are observing the social distancing guidelines. They take us through charts looking at public transport levels, for example, and they believe that most British people are being very disciplined about this, and they therefore believe that in the coming days we'll start to see more of an effect on the trajectory of the outbreak curve here in Britain. We keep hearing about green shoots already showing up in terms of some of those numbers, but at the same time we see deaths continuing to jump on a daily basis. The last 24-hour period saw the biggest spike in deaths in a single day so far. Again, officials say that those deaths are the last number that we will start to see come down. They're already pointing at data with regards to hospital admissions and positive testing out of those people who are receiving COVID-19 tests, and saying there is some evidence that the curves are starting to flatten, but it's those deaths which will come last. And so we're therefore at the same time being warned that while there are green shoots, in the next few days here in the UK, we are likely to see deaths continuing to rise as we head towards our peak, which officials, I think, but still believe will probably come at some point around this coming weekend.
Ollie, how is the British healthcare system, its infrastructure, handling this? You know, we hear a lot about Britain's healthcare, what's it called, the NHS, the National Health Service. It's widely admired around the world. Is it coping?
Widely admired, but also at this time of year normally under great strain because of the annual flu bugs and the difficulty with overloading the system at this time of year. And so a huge amount of extra capacity has been lined up for the NHS. We're also seeing other operations and treatments that aren't urgent being postponed indefinitely while the COVID-19 outbreak continues. As things stand, officials are reasonably confident with how the NHS is bearing up. They say that there aren't any areas where intensive care capacity and bed capacity is being overwhelmed. There is capacity throughout the system, even here in London, which is the worst affected region. The NHS Nightingale Hospital in London here, which is a temporary facility built in just 9 days with 4,000 beds in total, that started taking its first patients. So for now, spare capacity in the system, but no one being complacent about what might happen if the numbers continue to rise.
Aina Tangen, a few days ago we heard that there was a resurgence of infections in Henan province, and the authorities were concerned about that. In fact, they were still concerned at that point as well about infections coming into the country. Are health officials now pretty confident in this part of China, or in fact in the entire country, that there is not a great chance of a second wave of infections happening?
Well, yes, but you have to be vigilant. I mean, right now, all the new cases are coming from abroad. They had a hotspot also on the Russian border. They had to close it off. There were a number of Chinese who were returning from Vladivostok, and they had contracted the virus. So there has to be vigilant. But this goes to this issue about patchwork. It's not only within a country, but globally. Otherwise, you do risk reinfection. This idea that you can have 90% of the people doing social distancing and this will solve the issue is not correct. It's very clear that this has to be uniform, that there have to be high standards things. Well, one of the issues here is that, people should understand that China's at a different stage right now. They're trying to emerge. There's hope here. At the same time, there's a tremendous amount of despair in other parts of the world. China is trying to respond to that effectively and positively by pushing, saying, look, we want to help. But it's being kind of met with and rebuffed by a lot of suspicion and paranoia. So, this is somewhat to be expected, but hopefully, as things start to level off and people look in the cold light of day at what has happened, they'll understand that China had no ill intent and that it's simply going through the same thing that every other economy will be going through.
Peter, getting back to New York, if we look at the number of infections there, the number of infections are going up. I mentioned that figure earlier on, the number of deaths going up as well. But the New York governor has been holding a news conference every day to update people, not just in New York, but around the country as well, about what's going on. He says hospitalizations of those infected are actually going down. How does one explain that?
I don't really know how to explain that, except to say that I'm keeping an open mind. I've seen pictures of people on New York subway stops, again, being very close together, packed like sardines without masks on. So it's only a matter of time. And if you have enough prevalence in the population and you're not having community masking, that's context specific, it's going to, again, lead to a resurgence. It's just a staccato approach of maybe one day the hospitalizations are down, but I really need to see a continued pattern before I feel very confident that, either New York or California is on the right direction.
Right, and Peter, what are your feelings on this warning that we got from people at the White House last week, saying that this week, and the next week and the following week could be the hardest? I mean, is that where they expect us to reach a peak and then it'll drop off?
No, I think the way I interpret that personally is that it's going to be really hard next week, but that doesn't mean it's going to be really hard for the next 4 weeks. It's just that I think psychologically preparing the people to really brace for these hospitalizations of people that they know, that they love, their aunt, their neighbor, their loved ones, is something that's real, but I really don't know when it's going to end.
Brittany, in many respects, the United States has had to play catch-up insofar as caring for people is concerned. Hospitals are overwhelmed. We've seen that. There are still shortages of equipment and PPE, personal protective equipment as well. Do we know if that situation is getting better?
I don't know personally. I've heard anecdotal reports that some places are doing better, but I think some places are not doing as well also.
Ollie Barrett, what can you tell us about the situation in the rest of Europe, especially in the countries that were really hard hit, like Italy, Spain, France to a certain extent?
They remain very hard hit, those countries, but we are starting to see some real signs of light, particularly in Spain and Italy, that the curves are flattening there and starting to go in the right direction. Very stringent lockdowns in place in those countries that have been extended, and certainly officials believe that they have played a major effect in flattening the curves there. France continues to see a large spike, particularly in daily deaths. We've seen now a total of over 10,000 deaths in France of patients who had tested positive for COVID-19. The lockdown toughened in France as well. We're now seeing daily exercise restricted in daylight hours. 2 in Paris, where particularly officials were worried in a densely populated city that some people weren't observing the guidelines and that the virus was continuing to spread with person-to-person transmission and contact. So, you know, still huge concerns for some of those European countries, but signs of light as well, and obviously looking to Wuhan and other places in the world, even here in Europe, like Austria and Denmark, where they're starting to consider easing some of the lockdown restrictions, looking to those places, trying to learn lessons, also, you know, making sure that we don't see second waves of infections in some of these places where lockdown restrictions are eased. So those countries which are a little bit behind that in terms of the curve, certainly looking to examples about what might be coming next, if and when they are able to consider unwinding some of the social distancing guidelines.
Brittany, as we hear, the big effort around the world is to flatten that curve. What would you be looking for in the days and weeks ahead in terms of looking at benchmarks or signposts?
So we would want to look at the number of new cases decreasing and then starting to go down. But we would need several days or weeks of this information in order to make really good decisions about how the curve is progressing.
And how complicated does it get, Brittany? Because we're dealing here with something that is asymptomatic. People don't show symptoms, even if they have the virus.
So yes, that does complicate knowing how many new cases there are, because again, we're not testing people with mild symptoms, so we're certainly not testing asymptomatic people, and that can complicate things and make transmission look a little bit less intense than it actually is because of the number of asymptomatic people.
Peter, one final question to you. We had a very conservative estimate of the number of people who could die in the United States. In fact, the White House team told us that could be between 100,000 and 240,000. The upper end of that was really alarming. We heard 2.2 million. But looking at the figure right now of 12,500, do you think we'd see much lower casualty figures?
I think my feeling, until the U.S. has a unified approach, I really think that lower estimate is too low. Maybe the upper estimate is too high, but again, it's hard to tell. I'm very pessimistic right now until we all do the same thing. And no matter how long we do our own thing in California, again, our borders are porous and our disease screening at the border is not very intelligent. So until we do those both things, you know, who knows how many people will die first.
Well, let's hope we do all those things together. And that's all we have time for. Thanks to all of you for being with us. I'm Anand Naidu in Washington, D.C. Thanks for watching.